Hello, my name is Jay Huang. I'm a junior general pathology attending in the United States. I go over cases almost on the daily from head to toe. If you're interested in that, consider giving a like and subscribe. Without further ado, thank you to Pathlibrary for this virtual slide. Today we do neuropathology. This is a sellar mass in a 40-year-old male. So when I think of sellar mass, I think of, could it be a pituitary neuroendocrine tumor? Could it be a craniopharyngioma or like a raphe cleft cyst as well? But this, with the presence of kind of edematous, like loose-looking keratin, wet keratin, the lack of papillary architecture, I'm leaning towards a craniopharyngioma, adamantinomatous type. So what makes me think that? It's location. And then besides that, the histology, you see some basal palisading of these cells. You see this kind of edematous epithelium that's very faded with a lot of white space. So that's your stellate reticulum. You see some ghost cells here, and you see kind of this wet keratin where they don't have nuclei, they're very compact epithelium. We don't see any papillary structures. We don't see any cells that are salt and pepper like chromatin epithelioid. We see some nonspecific calcifications here. So let's see. Special stains. So you would want to do a beta-catenin, which should show nuclear positivity in a adamantinomatous craniopharyngioma because those are driven by a CTNNB1 mutation. A papillary craniopharyngioma, on the other hand, is driven by a BRAF mutation. Okay. So adamantinomatous craniopharyngioma. So as I was saying, you'll see these basaloid epithelial cells, kind of some basal palisading and reverse polarity, in which nuclei are oriented away from the peripheral aspect of the nest, as we can see here. You see the stellate reticulum and wet keratin. So your differential is papillary craniopharyngioma. You would see fibrovascular cores, no peripheral palisading or reverse polarity, and it would be driven by a BRAF mutation. So I thought this was interesting. Outside of the nervous system that has identical histology to adamantinomatous craniopharyngioma is dentinogenic ghost cell tumor. So these are benign Hu grade 1 epithelial tumors. They are in the cella or suprasellar region. They can present with visual disturbances as well as symptoms related to pituitary hormone irregularities and mutations in the CTNNB1 leads to beta-catenin overexpression, nuclear overexpression in adamantinomatous craniopharyngioma. All right, well, that is it for today. Thank you again to Pathlibrary for this online case and with these annotations, and I will see y'all next time.